Hello, and welcome to the Senior Rehab Project, the podcast for the community of rehab clinicians working to advance care for older adults. I'm your host, Troy Mead, and this is the Home Health Recharge segment, revitalizing and recharging home health. In today's episode, we're going to discuss sepsis and acute respiratory distress syndrome, or ARDS, with Shaunda Menke. And without any further ado, let's get started. All right, hello. Today I'm joined with Shaunda Menke. That's how you say your name, right?
Yes.
I hope I haven't been saying it this long without incorrectly.
That would be a long time.
Shaunda is actually a colleague of mine and an alumni of Elon University as well. And today I've asked Shaunda because she has a unique perspective with some of the experiences that she's had. And I asked her to come on to talk to us a little bit about sepsis and ARDS. Before we get started, I just kind of wanted to talk about sepsis and why it's important. You know, sepsis is defined as the body's an extreme response with the body to an infection. And I think this is important for our patients because some of the recent statistics say that 1 out of 3 patients who are in the hospital actually die from sepsis. So sepsis can happen when you have an infection already, and one of the, like in your lungs, your skin, urinary tract infections, probably where we see it a lot here in home health. And one of the complications that can come with sepsis is ARDS, and some of the risks for sepsis, and especially in our population, is people who are 65 or older. They're already kind of deconditioned, frail. They may have weakened immune systems, but the one thing I think to keep in mind is, even though it may be more common in the older population, that it can really affect anybody at any age, and that's kind of why I brought on Shaunda. So Shaunda, can you tell us a little bit about your story?
Yes, definitely. So I had my second son, and he was not even 2 months old yet. I'd been having for a while some just weird symptoms. And I kept thinking I was getting a urinary tract infection because, I just had a baby. My body went through a lot. Thought that was common. Every time the urinalysis was negative, they'd just tell me, don't worry about it. Finally, I went to one doctor, and she said, your symptoms are just adding up to something's weird. So I'm going to go ahead and put you on an antibiotic, and we're going to refer you to a urologist. And bear in mind, I'd also gone to the hospital emergency room because I spiked a giant fever. I think it got up to 103. It was probably a week before I'd gone to the primary doctor. And they told me nothing's wrong. You're testing negative for everything. I begged them to give me an ultrasound to check out my kidney areas just because I thought I knew something was wrong. They assured me, nope, it was just something weird. Don't worry about it. You get a fever of 103, kind of a concern. So went home. Again, that's when I went to the other doctor, and she said, something's wrong. I'm going to put you on an antibiotic, and we're going to get you a follow-up for the urologist. Then I think it was maybe a day or two later, all of a sudden I got that big stabbing pain in the back. And at that point, I knew it was a kidney stone. So got my mom to come over, went to the hospital. And in that time, when the pain was so severe, I ended up throwing up because of the pain. And unfortunately, on my way to the trash can to throw up, inadvertently, I aspirated on my emesis. So unfortunately, I did know that, or thankfully I knew that. And my breathing, I do have a history of asthma. My breathing kept getting worse. I kept trying to cough up what I'd aspirated, but it just wasn't coming up. Gave me a breathing treatment immediately. That wasn't helping. Long story short, ended up almost immediately developing aspiration pneumonia. And then, longer story short, ended up going into ARDS and on a ventilator, sedated, put on a paralytic. They were not giving my family much of a shot of me surviving. But thankfully, as one of the nurse practitioners in the hospital said, mamas, and new mamas especially, are the hardest fighters we know. And ended up coming out of it, and was able to return to my job as a physical therapist after a lot of rehab, and still working to this day to find my new normal, I guess it would be.
Yeah, absolutely. Because I kind of remember when that really hit you. I mean, it was like a shock to everybody in the office, and around the company to see something like this hit someone. You don't think about young, healthy, new parent. You know what I mean? It's not the typical uh, demographics or display that you would think that something like this would hit. And you had a long road to recovery. Is that right? You were on the other side of the of what we all do every day.
Oh yeah, the nurses in the hospital though, they kind of like that because they're used to their patients just hanging out in bed. But thankfully, my therapist brain took over as soon as I woke up. My mom even remembers they'd taken the paralytic off, but I was still under heavy sedation. And I guess subconsciously I heard the doctor and my mom talking over my bedside, and the doctor goes, well, you can tell she's getting really weak because look how her hand's kind of drawn in like this. I started doing my range of motion exercises. My mom said it was all she could do not to laugh in the doctor's face. So I guess even when I'm in a coma, I still want to do my exercises. Hey, but as soon as I got off the ventilator, I wanted to start sitting on the edge of the bed. I wanted to start getting up. So this is where, if you're working in the hospital or you're working at home, you have got to tell your patients the earlier they start to mobilize and start to work, the better. Because I am testament to the fact that, I was using a walker. What 30-year-old wants to use a walker? But I had to do it. I pushed myself. I had new goals to push myself every day. And that drive and that early mobilization, that is where the key is. You can't just lie around and wait for things to happen and get better. You got to get up and move. And that's where it was.
Just for some perspective, how long were you confined to the bed before you could, had enough awareness to try to get up? And then how weak were you on that first day when you tried to get up?
I was on the ventilator for 5 days. And again, that was not just sedated, but also paralytic. So they had the paralytic probably on for 4 days, the ventilator and sedation for 5. At that point, I started coming to. They really didn't think I was ready to come to, but my body was just like, nope, we're ready. Come to find out later, I think I was actually passing another kidney stone, so that may have actually been what started waking me up. Imagine that. So I started getting up. They were able to extubate me, I think day 6 or day 7. I can't really remember the full details on that. And that's a very scary thing, knowing that you're about to get this tube taken out that's been breathing for you, and you're hoping that the doctors and everybody are correct that you're actually going to be able to breathe on your own. That was definitely scary. So that when I got up, was awake, it was very difficult for me to even move my limbs because, again, I'd been under all that medication for so long. It does not take even a healthy person long to get weak, as we all know. So the first time I sat on the edge of the bed, I thought my head weighed 1,000 pounds. It was so hard just to hold my head up. And thank goodness the nurse was there. She was able to help me with the transfer over to the bedside commode. But man, it was tough. That is probably way harder than any of the workouts I've ever done. Just body and your muscles just feel so heavy, and it's just so hard to move anything. Definitely put a lot of things into perspective. It's like, oh, that's why my patients did this.
Kind of gives you a perspective on, like you said, I think it's hard to empathize when, we can kind of sympathize with our patients, but it's hard to empathize if you've never been through something like that, which I'm hoping that not very many people or you ever have to go through ever again. But,
Definitely.
But I think you have a unique perspective because you've been through it. You know what I mean? You know how weak they are coming out of the hospital, and that it doesn't take, for our patients sometimes who are already frail, it doesn't take that big of big of a medical condition, but to keep them in the bed for several days like that, and they can feel the same way, kind of getting up and then getting home. How was it when, since we're home health, how you spent you said several weeks you went to an inpatient rehab, is that correct, for a little while?
No, thankfully I was able to go to outpatient rehab.
Okay.
The doctors, they saw how I was doing and knew that I'd given my profession. They knew that I was going to do what I needed to do. So they let me come home. They were going to write orders for home health, but I told them, I'll be fine. I'll let you know if I need something. Had I not had the medical background and been doing like I was doing, and I think also knowing that I had a 2-month-old at home, they kind of let things slide a little bit with me that with our frail elderly patients, they're not going to let slide as much. They also knew that I was walking and doing everything that I had to do in the hospital. But they assured me that if on my follow-up appointments, if I was not looking right, they were going to be throwing me into rehab even quicker. So thankfully I was a good patient. But you got to think about it. Most hospitals with our little frail patients, unfortunately anymore, even under best of circumstances, they're not letting them get up and move around because of, unfortunately, lawsuits and things like that. So even our patient who just has pneumonia, they're at so much of a risk of things developing because they're not getting up and mobilizing because the hospital is throwing on the bed alarms and the fall alert bracelets, which for good reason, but they're not getting up and mobilizing. Well, the mobilization is what's so important and helps decrease risk of these further things happening, like aspiration or sepsis developing or anything like that. So it's just kind of a catch-22. That's why our therapists in the hospital come in so handy.
Yeah, and I know a lot of those are fighting what they call the PJ paralysis, in the hospital, where it is that give and take of early mobilization and also the liability of it, which, can sometimes, unfortunately, can be over restrictive and unfortunately sometimes win out when it comes to things like that. But then it's really kind of doing a disservice to that patient. So what was it like when you first came home? You got home, and did you find that it was harder to handle than you thought it would be?
Oh, 100%. When I was in the hospital, I was under the crazy delusion that, I'll still be starting back work in a couple of weeks like I was supposed to. No big deal. I may take an extra week or two off. I don't know what kind of crazy land I was living in, because obviously that wasn't happening. And my family was just like, okay. I remember my husband, of course, dear sweet husband, he goes, okay, honey, we'll talk about it later.
We got that. That therapist craziness where we think we're immune to things like that, right?
100%. He was like, okay, honey, we'll talk about it later, and just kind of kissed my head. And then he's like, yeah, I knew you were crazy and you'd figure it out eventually. And I just didn't want to get your hopes down at that point. Thankfully, I realized it on my own very quickly.
Yeah. And also, like you said, you had a 2-month-old to take care of as well. I mean, most of our patients don't have that coming home as well. Yeah.
I couldn't even, thank God my mother-in-law flew out from Colorado and she stayed with us, but I couldn't even lift him up.
Yeah.
To hold him, they would have to put him in my arms. I couldn't carry him. I could, if he was somewhere like on a changing table, I could change his diaper, but I couldn't, like, to get on the floor and play with him, I could barely even get up off the floor. So it's just, I can see how our little old patients, it just put huge perspective into my eyes. It was kind of like, oh man, I was a healthy 30-year-old. Our little 80-year-olds are not generally this healthy when something hits them like this.
And not to mention all the psychological stuff that goes with it too.
Oh, 100%.
Because you go from being one way to the next 2 weeks later, being dependent on somebody else for getting around your home. So that's kind of...
Yeah, so to walk, I would have to push him in a stroller to walk because I couldn't walk down my road by myself because I would probably die of exhaustion. So instead of a walker, I would just push him. So that's kind of how I got by with that.
And just to put some perspective on just how long the effects lasted, it's taken you a while to I don't know if you are you at 100% yet? I know you've had a lot of
No.
issues with endurance and breathing and
Yeah,
everything.
it's been over 2 years out, and right around the time of my 2-year anniversary, I was able to walk a 5K. And that was kind of like my big, big goal I set for myself. And, everybody cheered me on, but told me, if you don't feel like you can, because we did it at Disney. We did the Princess 5K. And everybody said, they've got the people, the medics are all around there. That's why I chose that one, because I knew that, A, Disney is our special place, but B, I knew that it was going to be probably one of the safer places to do that type of thing. And I just walked it. Couldn't jog it, couldn't do anything like that. I just walked it. With these hot heat, because right now it's July, end of July, so it's very mid to end of July, so it's very hot outside. I can't stay outside for long. My family will go out and they'll swim in the pool in our backyard, but I can't, when it's really hot, I can't do that. I maybe can sit in the pool or just kind of stand there in the shallow end, but I can't do as much as I previously could, which, that's part of what I always tell people, you just find your new normal.
Right.
And it's same with all of our patients. We have to help them find what their new normal is going to be. We hope to get close to 100%, but sometimes we do, sometimes we don't. It just depends on how severe the impairment was and the disease process.
Exactly. And you're keeping working at it too. Going out there, you're doing your 5K still, you're still working on it. So, it still continues after the therapy's done.
100%.
So one thing that it has done is kind of giving you a different perspective, and you've also been a little bit more involved with some of the organizations out there about sepsis awareness. You want to talk a little bit about that?
Yes. Thankfully, through one of my husband's friends, they put me in touch with Audrey Leishman. And some of the listeners may know about her from her husband, Mark Leishman. And he is a PGA golfer. Back when he was doing the Masters 3 years ago, because I think hers was a year before me, it was 3 years ago, he got the call while he was basically out on the golf course that he needed to rush home immediately. She had ended up with sepsis and toxic shock syndrome from her tampon use. So her website is PS Don't Use Tampons, but she talks a lot about the sepsis and how it affected her, a lot of the signs of sepsis. But how we got in touch was my husband's friend got us in touch. She gave me a call or gave me her number, and I called her. And it was just a huge relief to talk to somebody who pretty much had been in the exact same shoes that I'd been in. Young mother, 30s, going through something very life-altering. And she was able to talk me through it. But what she did, thankfully, because her husband is in the PGA, and through some of his golf earnings, they started the foundation called the Begin Again Foundation. And they do lots of research and help with specifically sepsis, ARDS. They also do some with children's hospitals. But they will, to anybody who has one of those diagnoses, sepsis, ARDS, that sort of thing, they will give them a one-time scholarship of $1,000 to essentially begin their life again. And any of my patients who have any of these diagnoses, I immediately send them that way, because $1,000 is huge. I mean, that's a mortgage.
Right.
That's all sorts of things that, unfortunately, when people are in the hospital, especially if they have to be in the hospital for a prolonged time, or not even in the hospital, they just can't work, or, XYZ, their family, anything like that, that $1,000 is huge. So I always will definitely recommend somebody going to apply for that. And it's really simple. You just go onto their website, Begin Again Foundation, and you just search it in Google, and they will just click on the different buttons and you can apply for it, or tell your patients to apply for it.
I think we're going to have to put that link down in the show notes so people can
definitely
get access to it. Well, great. Is there anything else that we haven't covered already?
I think that's essentially it. Just you bear in mind that what we've already talked about, that it's a tough road to recover, and the key things are early mobilization. Also, watch your patients for the warning signs. If they start getting that fever, like I started having that fever, I knew something was wrong. Something was wrong. Have them be persistent with the doctors like I was. Don't second guess anything, because these little things happen quick. If I wasn't in the hospital when that happened, we probably wouldn't be having this conversation. So it's just, be your patient's advocate. If they are noticing something strange and the doctor's not responding, do like I did. Have them go to another doctor. Have them go to another doctor until somebody will listen, because that is just the huge thing, is early detection.
Well, that's a great message. Thank you for being an advocate for your patients, and I thank you for coming and talking to us.
No problem. Thank you.
Thank you for listening to the Senior Rehab Project. If you gained from this episode, please consider supporting our work. You can become a patron through Patreon, a service that allows people like you to support people like us. You can give as little as $1 a month or become a game changer for $8.99 a month, where you'll get an awesome redefined old mug and access to our monthly meetups. Just go to seniorrehabproject.com to learn more and find the show notes for this episode. So talk to you soon, and don't forget to stay funky.